Hello everyone, this is your host Kevin McArdle. Thank you very much for joining us and welcome to this program on the 5 potential pitfalls to avoid when transitioning to the cloud. For this program, we brought together a group of thought leaders and experts to help bring further clarity to the decisions that you're going to be making around your IT strategy and technology deployment within your organization. You'll be hearing from Chris Olberg, CSU's Chief Technology Officer. You'll also be joined by Jody Nelson, our Vice President of Healthcare Applications. Chris Meyer, our Director of Cloud Service, will be giving us some insights as well. Kevin Borboom, our Controller and Interim Chief Financial Officer, will be talking about some of the business and financial pieces of this as well. And myself, Kevin McArdle, I'm the Chief Revenue Officer here at CSU Healthcare IT Solutions. It's important for you to know that this webinar has been specifically designed to give you some high-level strategies, best practices, and practical tools to help you get the results that you deserve from your organization. Today's webinar is being recorded and will be made available to you following the program. So you'll be receiving an email from us with a copy of the recording for you to refer back to as well. And Megan O'Leary, our Director of Marketing, is available to field questions from you as well. So I would encourage you to submit any questions that you may have through the GoToWebinar dashboard on your screen, and we'll do our best to answer them throughout the webinar. I do want you to know that in the time that we have together today, we'll be giving you lots of content-rich material. And at the end of the session, I'll let you know how you can have greater access to more information about the topic. So let's get to work. So here's the fundamental question we're setting out to answer is, should you move your ER hosting to the cloud? This is the on-premise versus off-premise decision that all organizations are faced with at some point. And when you're facing a hardware or software upgrade, one of the biggest decisions that you'll have to make is whether to move your healthcare organization to cloud-based services. And the reality is, despite what some people will tell you, there really is never a one-size-fits-all plan for every organization. In order to avoid any surprises or hidden charges or unexpected setbacks and delays, you're going to want to look out for the 5 potential pitfalls that we're going to address in this webinar today. And let me begin by just setting the stage on kind of what's happening and some major trends in cloud adoption and some of the things we're seeing across healthcare organizations today. According to HIMSS Analytics, they did a recent survey, and that survey indicated that upwards of potentially 85% of IT executives report that they're using cloud services in some form today, in general. And in terms of adoption within healthcare organizations and health systems, 73% of health systems with more than 300 beds and 81% of providers with fewer than 300 beds are shifting their focus to IT outsourcing for development and of complex infrastructure and support services. So we're seeing a huge trend in moving from on-premise to cloud-based solutions. And so some of the things that we want to consider are, what are some potential pitfalls for you to avoid? We're going to point out 5 of those potential pitfalls that we've uncovered. We'll give you some case studies, and we'll give you some specific strategies to address and avoid those pitfalls. So the first pitfall that we're going to take a look at today is around staffing capability. And Jody Nelson is going to be giving some insights and some observations and some perspectives and some recommendations around staffing capability. So with that, I'm going to hand it off to Jody. Tell us what you know about staffing capabilities.
Absolutely. Thank you, Kevin. When comparing and contrasting hosting of your healthcare solutions on-site versus in the cloud, one of the key components that we need to address is staffing capabilities. Running your hosting in-house requires specialized IT knowledge, and it may be costing you more than you think. When you look at specialized IT knowledge, you need to look at technology infrastructure, advancements in that technology infrastructure, as well as enhancements, government mandates and requirements, including such things as HIPAA or meaningful use, etc. And so IT knowledge is a key component to address and look within your organization to see if you have that specialized skill. So when we look at skill gaps, do you have an IT generalist running your department, or do you have specialized skill sets in the required variety of areas to host your own solution. And again, we're looking at contrasting on-premise versus an in-the-cloud solution. Costs is one of the first pieces to address from a staffing capability perspective. What type of budget or costs are associated with your IT analysts or engineers on staff, as well as what other third-party costs you may need to acquire due to not having that specialized skill set in-house. Unsuccessful implementations is another potential pitfall when looking at whether you can host on-premise or within the cloud. When you look at unsuccessful implementations both from a budget perspective, a timing perspective, etc., do you have the specialized resources with the necessary training to make these implementations successful? Security gaps. Security tends to be one of those pieces that gets missed when we're looking at comparing and contrasting staffing with an on-prem versus off-prem solution. The security, as we've all learned in the marketplace, is very, very important in terms of protecting the necessary data. And we need to ensure that we've got individuals that are well-versed and keeping on the cutting edge of ensuring what technology is out there to ensure we are making those gaps secure. Inability to manage budget and schedule. Again, when we look at this from a staffing capability perspective, do we have the devoted resources to manage budget and schedule the necessary components of that being an on-prem versus a cloud-based solution? And when we look at managing budgeting and scheduling, you're looking again at infrastructure, you're looking again at the actual environment that the technology is residing in, and making sure that you have the necessary individuals that can manage to those budgets and schedules. And then finally is the inability to fully utilize your technology. I'm sure many of us have purchased new technology in our organizations and are using just a very, very small component of that technology. And we would look to want to optimize and ensure that the technology that we're purchasing and that we are using in our organizations are used to full capacity. An example, when we look at some of the different areas of skill set needed, stem around applications, desktop work, network technicians, and system and storage or data center individuals. What this diagram is showing is a service offered by SISU that provides a great example of the data center services and the necessary skill sets of individuals to perform those tasks. So if we start at the top of the diagram, you can see there needs to be an infrastructure, and whether that be virtualized or not. And then we need to have the desktop technicians, network technicians from a connectivity perspective, as well as system and storage technicians. These technicians need to be well-versed in many different brands of technology and need to have a full functioning understanding of how those pieces and parts work together. Likewise, in this diagram, the level of blue boxes represent the application specialists. And in many cases, the technical folks focusing more on the network and system side need to have full integration with those individuals at the application level to really be able to dig deep and understand where the issue may be residing if you're trying to troubleshoot. Unrecognized costs. Supporting the IT function within your facility, we would ask that you look at an on-premise versus cloud solution. You need to recognize and understand your costs. Have you truly identified what the service is costing you? A couple of areas that we've done some research in as of late is looking at other individuals within an organization and what percentage of their time is spent in an IT capacity. What portion of a nurse's time on the floor is spent supporting IT is one of those examples. who takes on the required clinical and financial reporting, and who is doing your meaningful use reporting, who is performing any analysis as it comes to the regulatory bodies, and who is reading the regulations from CMS and boiling this down to changes within the system, validating the necessary data, etc. If it's your clinical staff, this is a problem. It may be costing you money. And so as you evaluate whether you're looking at providing an on-premise hosting solution versus a hosting solution for your healthcare solutions in the cloud, this is one piece to definitely take a look at. What percentage of staff's time is attributable to IT? We were able to perform a case study for a recent critical access hospital and wanted to share those results with you. For this given organization, IT staffing costs for the hospital were reported as 4 full-time equivalencies, or FTEs. The organization spent a significant amount of time digging into the actual work being performed by many different individuals within the organization. And the reality was that the facility had an equivalent of 7 full-time individuals performing IT functions. However, they were not classified as IT staff. One other piece that we want to definitely take a look at from a staffing solution perspective is in smaller communities, the skills and experience that you need and are likely difficult to find and attract and hire, afford, and retain. So when we look at these smaller communities, we want to make sure that we're looking at the fact that we would be able to attract, hire, find, and afford these individuals from a staffing perspective. So as we look at some of the insights from a staffing solution perspective, do you have the right IT staff resources at your hospital? Do you have the necessary skill sets to perform those functions? When you look at your IT staffing budget, do you have the necessary budget to cover whether you're looking to complete an on-premise hosting solution or off-premise or cloud solution? And then third, are you in the business of healthcare or in the business of IT solutions? And where would you like to direct the resources that you have within your organization?
Thanks again, Jody. Couple of observations. I know one of the things that has really resonated with the people and the organizations we've been talking about is this whole invisible cost, these FTEs that are hidden. And your case study was a great example of, they thought they had 4 IT people, but in reality it was being supported by 7 full-time equivalents. It looks like Megan just texted us that we have a question from Ken, and Ken is asking, what specific skill sets should I be looking for in my organization to support IT? And I know that you talked briefly on that, and I'm going to paraphrase here, but Ken might be asking the question, should he have on staff or should he have, off-premises support? But I think his real question is, what are the specific skill sets that he's going to need to know to close the skill gap in his organization? So can you give us some insight on that?
Absolutely. When we look at staffing and the required skill sets, when you're comparing and contrasting an on-premise solution versus a cloud solution, if this is something that you're looking to bring in-house, you need to have a wide array of very detailed skill sets. So you're going to need server knowledge, as well as storage solution knowledge, connectivity, and how all of these pieces and parts fit together. And one of the key components that many organizations fail to understand is not only do you need the actual technology pieces of equipment, but you also need infrastructure or the space to support that, heating, cooling, electricity, etc. So do you have those skill sets that you're able to bring to bear as well?
Good insight. Good insight. Thank you, Jody. Okay, so Jody just kind of walked through the first pitfall of staffing capabilities, which brings us to our second pitfall that we've uncovered, and this is really revolves around maintenance and updates. And I'll tell you, when we were putting this program together, this was an area that for me really came as a surprise, and something that is often overlooked is the whole maintenance and updates of your hardware and software. And so Chris Meyer has some good insights and some perspectives and a case study to share with you around the second pitfall of maintenance and updates. So Chris, I'm going to hand it off to you.
Thank you, Kevin. Good afternoon, everyone. As Kevin mentioned, oftentimes when you're looking at the evaluation between an on-premise solution versus hosted, one thing that really gets overlooked is the after the purchase work, or the maintenance and updates, the care and feeding of your capital investment in that hardware. So we're going to spend a few minutes talking about why that's such a significant area that needs to be considered when you're doing that evaluation. So managing system updates and upgrades, it takes both time and staff resources to do properly. It's critical to ensuring that you have your utmost availability of your EHR and other applications that you're running on those systems. So understanding what updates are available is really one of it's overlooked often, because most people are accustomed to Windows updates that are pretty much hand-fed to you every month, but there's a lot of updates and patches that aren't as visible or apparent to the IT staff. Some of the updates that you're going to want to consider are, they serve a couple of different purposes. One, the obvious one, is security risks. Software and hardware vendors often recognize holes or flaws in their code that requires patches to be released to mitigate those security risks. Secondly, and this one is actually less obvious to most people, and that is bugs in code that can sit dormant in systems and is not readily visible, but can expose themselves when you least expect it. That second scenario, the impaired system functions, that's something that I can speak directly to and have some real-world experience with. It'd be nice to be able to sit here and tell you that, you know, I've had a flawless career and everything I know about system disruption is theoretical and through publication, but we have had an experience here at SISU even approximately 12 years ago where it was our first foray into centralized storage, or SAN technology, and we bought a very robust storage array, had all the bells and whistles, and everything was running great. It housed all of our customer data, and unfortunately one day it just failed. It broke, and that failure caused 2 days of system unavailability. Not only did we have to repair the system, restore some corrupted data from backups, but over those 2 days, data had to be manually entered. It was captured on paper and then had to be re-entered into the system after it was back up. The worst part about that failure is that there was actually a patch available that could have prevented the entire thing from happening. We were completely oblivious and unaware that this patch was available. And because of that, we were unable to be proactive and make sure that the system stayed up. That was a great learning experience for everyone who was involved, anyone who actually knew about it. And it really speaks volumes to the diligence that has to be paid into understanding every single component in your environment and where to look for available updates and system patches. So once you do find that information and you get the pile of fixes and patches that are available, there's a couple things that you really should be looking at. Number one is, what is applicable to your specific environment? Every environment's unique. They're not all designed the same. Even though a lot of them might use the same components, they're not used in the same way. So not every update that's available applies to your given scenario. And there's some risk in just blindly applying every update that's available, because what you're doing is introducing change in your environment that can have it can create unnecessary risk and create issues for you that were unforeseen. That brings us to the second one. You need to really understand, once you determine which patches apply to you, how is that patch going to affect your entire system? As Jody mentioned earlier, you have a variety of components, whether it's servers, network devices, storage. All these things are interconnected, and each one depends on another. So when you update one system, it could potentially cause a disruption of service in another system. It takes a lot of time to not only find those available fixes, but evaluate them and then determine which ones really will fit into your environment. That really brings us to testing, and best practices for managing any kind of critical infrastructure is going to have a testing component. Your testing environment should be dedicated for that purpose. You don't want to have it connected with your production environment in any way. It really should allow for failures. That way you can test patches, you can test fixes, you can test changes, and see what the impact is going to be, rather than just crossing your fingers and hoping it doesn't cause an issue. Secondly is having contingency plans. You can have all the due diligence in the world, but things go wrong sometimes. So when things do go wrong, what is your plan, and do you have the right people and skill sets in place to recover from a failure? So some key insights. Really, maintenance is not something that you can just do once a year. To properly manage a high availability environment, it takes constant care and feeding. That takes a lot of skill, a lot of resource and labor and time. And that's something that most IT folks would prefer not to spend their time doing. There's a lot more value they could be providing to the organization through innovation and optimization of the investments that have been made in the applications. Best practices for test environments. You really need to have a test environment or a sandbox where you can apply changes and it's not going to impact performance or availability of your infrastructure.
Nicely done, Chris. I'm thinking that our viewers might, as they're weighing this decision of bringing their healthcare organization to a cloud-based service, Chris, they might be asking the question between on-premise and on-premise type of hosting. Could you help us understand the distinctions between maintenance and updates on an on-premise situation versus off-premise? You've drawn the line and some of the pitfalls.
Sure.
Draw the distinction, and how does that take place in an on-premise setting versus an off-premise setting, and are there advantages with one over the other?
Absolutely. So there's a couple of different things there. If you're looking at an on-premise solution, for one, it's the time and resource that it takes to manage and maintain the system. Secondly, when you talk about a test environment, not only are you looking at the capital investment in production equipment, but you can almost double that when you consider creating a test environment. So when you look at a hosting solution, they employ staff. I mean, I can honestly say I hire Blinky light engineers. So their sole purpose is the management and maintenance of those components and of that critical infrastructure. In test environments in a cloud scenario, it's designed to allow for test environments.
So all of that, the issues that you raised around the potential pitfalls around maintenance and updates is now moved to and handled by the service provider and the hosting provider.
Absolutely, and it allows the on-premise IT staff to refocus their time into more productive things, furthering the business goals through the actual use of the technology that they've invested in.
Understood. Understood. Okay, good insights, Chris. Thank you. Okay, so Jody talked about staffing capabilities. Chris just shared with you some insights around maintenance and updates. It moves us to the third pitfall or potential pitfall that you want to avoid when you're considering moving to a cloud-based solution, and that is around time to procure and implement. And this is really the ramp-up time and the time it takes to go from your existing to your new, and how that procurement and implementation takes place. And so joining us now is Chris Oberg, our Chief Technology Officer, and she's going to share some insights and a case study around time to procure and implement. So with that, Chris, talk to us about time to procure.
Yeah, thanks a lot, Kevin. So put yourself in the situation where you've made a decision to make a change to your technology environment, whether it be a small project, meaning you're going to bring a new application on. Maybe it's maybe you've never used technology to do your CRP or CRM or your ERP in-house for some of your technology solutions, or maybe you're actually looking at a full-scale upgrade of your EHR solution, or maybe you're working in a hospital that has been using paper for years and actually wants to move to a technology environment. The time to implement these solutions can really vary dramatically between an on-premise and a cloud-based solution. And that time can actually impact the project overall, including the revenue, the cost, the staff, and so on. A couple of things to consider immediately are, what is the scale of your project, and is it going to require a facility upgrade potentially, and is it going to require the purchase, the upgrade, or the just new acquisition of a lot of technology, hardware, servers, and potentially even new rooms to house those servers, a lot of PC equipment, etc. In the on-premise solution, you're probably looking at, in terms of scale to implement, years if you have a facility involved. And I'm not talking a lot of years, but 2 to 3 years is not uncommon in a very large scale new EHR implementation. In the cloud, you can probably cut that in about half. So what are the things that really go into your decision-making process here? The first thing you want to take a look at is, are you going to need to make physical improvements to your building? Do you have the floor space and the facility required to house your new technology? Do you have generators? Are you going to have to procure generators outside, fuel tanks? Do you have UPSs and power? One consideration is that not everywhere in the world has enough power. We happen to be lucky in northern Minnesota with the infrastructure we have due to the mining industry here, that the power is very, very good. However, in some parts of the country, that infrastructure is not even present. And I have worked in other places where power was simply not available. And so big consideration. Also, your heating, your air conditioning and cooling. And think about this, is that the requirements to power infrastructure and information technology infrastructure is different from what's required to keep your patients comfortable and your employees happy in the hospital. So different requirements. Are your facilities and your plant folks prepared to take on that new project or those new requirements of servicing a different type of resident within the hospital or the facility itself? Second of all, there is a process that you are going to have to go through to procure your technology. That process really consists of, first of all, you have to define your requirements. What do you need? What are you trying to do? The second step is to select and narrow your vendors. Third, now you've got your vendors selected, you've got to actually take the time to evaluate their solutions, and you've got to select or narrow the field down to vendor of choice. Once you've gotten the vendor of choice, you're going to go through a contracting process. You're going to negotiate. You potentially have some board decisions or some governance, whether it be a hospital board, city board, county board, etc. And then finally, you're going to have to receive and build. So that takes there's a long timeline in working through that process. Do you have the people, the staff to actually run that process, and so on? So let's talk a little bit about a case study. This case study is a critical access hospital, the current state of which they were looking to upgrade their EHR environment from a relatively simple EHR environment into a much more complex environment. Their current state was a handful of servers. Their facilities were okay. However, they're moving from a point where they were working with a handful of servers to a future state consisting of 50 plus servers and a much more complex architecture, an N-tier architecture involving web servers, database servers, application servers, and so on. In this case, their on-premise solution was probably going to take about 2 years from the point of inception of the project to actually getting their new EHR environment to a go-live state. That required the on-premise, or the procurement and the setting up of the facility and racking and stacking the equipment and making it accessible was about a year in length, where they still had additional work to do beyond that to actually implement the applications that they were putting on that infrastructure and making them available to hospital staff. What happened in this case is, because they chose to go with an off-premise or a cloud-based solution, is they were able to cut that time in half. The procurement and infrastructure stand-up was reduced to weeks instead of months. So, like I say, they were able to cut that overall project time roughly in half. So what are the insights? When you're working through, the insights that we've gained and we understand are that, you know, number one, how is this a delay in the timing going to adversely affect your hospital? So whether you choose to go on-premise or off-premise, there's a potential for lost revenue, lost opportunity. There's an impact to patient care potentially, and then also an impact to employee morale. Should you make the wrong decision or run into an unforeseen situation, in a cloud-based solution, we're able to reduce those risks substantially because of the specialization of the folks actually standing up the equipment. In a cloud-based solution, you have skill sets that are specialized in actually standing that up. So you're able to reduce the risks of that. Number two, so what are the barriers that are going to affect your installation? In a cloud-based example, for example, you do need to consider whether there are some barriers to standing up the solution and making it accessible. A good example here would be a telco line. For example, in a cold climate, let's take Montana, where there may not be a huge amount of infrastructure to telco, and they have to dig lines into the ground. That would be a consideration for a cloud-based solution. In an on-premise example, we've talked about this extensively. You have to build out the space in the hospital to accommodate the hardware. The third and final insight is, where do you want your staff spending their time in the hospital? Think about this. Are you in the business of healthcare, or are you in the business of information technology? By moving to a cloud-based solution, you're really able to focus your staff. As Chris pointed out earlier, that you're able to focus your staff on spending their time doing what their skill set is really specialized for, which is their IT time can really be specialized on making these solutions, even the cloud-based solutions as well, accessible and available to your line staff who's actually having to apply. This would be your doctors and your nurses and your administrative staff. Kevin, thank you very much.
Sure, great insights. I love the case study. I mean, literally cut the implementation time in half by moving from an on-prem to an off-prem solution. Early on, it was actually your first slide, Chris. Janet posted a question around infrastructure, and her question is, when and how do I go about evaluating my infrastructure needs? And so I think what she's asking is, is the technology person telling us that? Is it the architect? And when do I start that in the process? So can you provide perspective on that for Janet?
Yeah, my recommendation is to consider that immediately. As soon as you have determined that you have a business initiative or a need for some infrastructure, IT infrastructure, or some technology to come in and to provide some business case for you, I would consider that right out of the gate. First of all, whether I go on-premise or off-premise is a decision, as we've talked about. It's going to require, especially in the case of a large implementation of, for example, an EHR or a large number of software applications, you need to consider that very early on. In fact, put it in your list of things that you have to evaluate immediately. Take it off the table as soon as you can. Whether you go on-premise or off-premise, it really doesn't matter, but put that on the table immediately and get that decision out of the way.
Good. I think that's good insight for Janet, and I think that addressed her question. Nicely done, Chris. So far we've talked about 3 of the potential pitfalls that we want to avoid, or that you want to at least address and avoid when you consider moving to a cloud-based solution. Jody talked to us about staffing capabilities, and then Chris highlighted some of the insights from maintenance and updates, and then Chris Oberg just talked about the time to procure and implement. As we move into the 4th pitfall, this is typically where the conversation begins, and it is around understanding and recognizing your real costs. And I think what you're going to find with some of the insights that Kevin Borboom is about to share with you is this is a deceptively simple question that has very complex answers to it. And because the initial question when we're considering this is, the first thing we hear is, okay, how much can I save by going to an off-premise solution? And Kevin is going to give us some perspective and some insights on understanding and get your arms around and recognizing your real costs. And so with that, Kevin, share some insights for us around the financial aspect of cloud-based solutions.
Thanks, Kevin. Once again, my name is Kevin Borboom, and prior to my position here at CISU, I audited healthcare institutions for the auditing firm RSM. I almost said McGladrey. Prior to being RSM, it was McGladrey. Actually, I think before it was McGladrey, it was known as RSM McGladrey. In auditing healthcare institutions, I think I was able to get a wide variety of exposure to how these institutions compile their costs, which usually start out as invoices, and how they analyze them and how they maintain them in their financial reporting mechanisms. And in addition to my exposure there at McGladrey, since I've been with CISU, I've actually been a part of the process of decommissioning an out-of-date data center. And whenever you do something like a decommissioning an asset, that's where it's kind of like draining the pond. A lot of things that you were unaware of kind of float to the top, and you're exposed to costs that maybe you hadn't seen before. And as part of that process, I was also involved in expanding into a brand new state-of-the-art data center here at CISU. So I'm going to talk about how well do you understand your IT costs, and all of them, and the associated risks relating to those costs. So when we talk about IT costs, of course, your accounting staff know all of your costs, but the key thing is, are they able to parse out what actually is your IT portion of those costs? And it's important to know exactly what is related to IT, especially when you're evaluating a prem versus off-prem solution for any of your specific IT needs. So the first step in evaluating the financial requirements of the on-prem or a cloud-based solutions would be thinking about the very different capital requirements and resources that each solution would need. On premises, of course, you're going to have a significant capital investment. Not just in equipment, but you're probably going to have to increase your footprint. You're going to have to think about uninterruptible power supply, generators, etc. On a cloud-based solution, you have little or no capital investment, but you will have you're probably going to be entering in some type of long-term commitment that may have some hidden costs associated with it. So 2 issues to consider relating to these 2 options is access to capital. And access to capital prior to 2008 was probably a little simpler than what it is now. If you guys all remember what happened in 2008, banks got overexposed to the mortgage markets. They have been forced under some new rules that make actually access to capital a little more restrictive. So even companies with moderate to strong financial statements may not necessarily have access to borrowings for capital for larger projects. And then even under that scenario, if you even have access to capital, your cost to capital may have changed since 2008. One of the things that I personally have been seeing, though, there's still plenty of access to finance for equipment, but if you're talking brick or mortar or any long-lived assets, access to capital may tend to be more costly. Second part I want to talk about is understanding the real costs of your IT. I think Jody talked a little bit earlier about the cost of actually certain staff maybe being hidden and actually not being parsed out as part of IT. There are direct out-of-pocket costs related to IT. These are things that flow through your accounts payable system and are easy to identify, especially if it's on invoices that are directly related to IT costs. There are opportunity costs with whenever you're evaluating two different financial situations. Basically, the opportunity cost is what could you have done with your funds and resources if you didn't choose the particular path you chose. And then especially when you're talking about on-prem and off-prem situation, there are time value of money considerations that you need to think about. One of the things we find in the IT business is IT costs don't appreciate. They come down very quickly. So if at any point in time, if you're going to make a large capital commitment into equipment or IT infrastructure, what is the real cost of making that investment when you're looking over a longer term horizon? Second thing I think it's important for them to think about is, again, can you uncover your real costs? Are those costs embedded in your departments? And within the healthcare industry, since we have governmental institutions, we have for-profit, not-for-profit, we have critical access, PPS, there's no real standard way for us to capture and organize costs as it is specifically relating to IT. Can you isolate your real costs? Are your IT staff your only IT labor costs? Are there nurses that are acting as IT support personnel, and are there people in your administration that are actually spending significant amounts of time relating to IT? Maintenance, software, and hardware costs, these can be very difficult to identify, especially, I'm sure I'm not the first financial person who's heard from their IT departments that something needs to be updated, maintenance, something happened, and maintenance has to be added back to a prior year. So these costs are very difficult to uncover, especially when you're doing budgeting and planning. So all of the above makes IT costs very difficult to isolate and evaluate in any scenario. A couple things relating to on-prem, off-prem. On-prem solution, especially in the healthcare environment, you're going to be looking at a 6 to 7 figure investment. And you're also going to be assuming several risks that you are going to have difficulty applying costs to. You're also going to have a build-out of 150,000 plus. Things that people may not be thinking about is increasing generator capacity, HVAC considerations for cooling, and how much of a footprint any hardware requirement is going to need for any particular situation you're going to be developing. On a cloud-based scenario, one of the first things you're going to have to think about is connectivity, networking and connectivity, because we do find that not only do you need connectivity to whoever is providing you your data, but in today's healthcare environment, we're finding that we need a lot of connectivity on a provider-to-provider basis. Also on a cloud-based solution, there can be additional unexpected costs, possibly cancellation fees, long-term commitments where you don't understand all the variables that can be associated with entering into those long-term agreements. So some of the insights I'm hoping you take away is that are you making the best use of your capital when you're determining what is your core business, what you're trying to do, versus making investments in IT infrastructure. You need to fully understand the real costs and real risks associated with expenditures, and sometimes these are difficult to do unless you actually go all the way to zero with one particular situation and cover all the costs. One example of this I personally am aware of, we knew that when we updated our flywheel system at one point, that we knew that our energy costs were high, but one of the things when we swapped things out, what we didn't understand is exactly, since that electrical meter wasn't on a separate line, is exactly how much those flywheels are actually costing us. Having someone with IT expertise on your side can help you better make smart decisions. We are seeing a trend, especially that's really picked up in the last couple of years. A trend in IT is being very commoditized, and it's actually it's becoming even, they call it disruptive, the way that the availability of compute and storage and how quickly those costs are coming down. And the bigger you are, the more discounts you see in making these purchases, and you can make the purchases more often as the technology emerges very quickly. One of the things in considering IT expertise for helping you make these decisions is any non-healthcare hosting provider may not understand your security requirements. These are places that are doing mass storage like Amazon and Rackspace, but are they really going to understand actually the risks and needs of a healthcare organization? And then do you understand the difference between public cloud versus private cloud? Whenever data is shared, especially over something like the internet, you need to know, is it protected and when is it not protected in certain environments. So hopefully I was able to provide some insight, and that's all I have.
Nicely done. I'm sure you did. You know, if we look at our audience today, we have both C-level executives sitting in on this webinar, as well as technical people. And I think what is coming to light is this is not just a technical decision, it's a financial decision, it's an infrastructure decision. There's a lot of moving parts to this. And so, Kevin, I think your insights were extremely valuable in helping our audience get their arms around the real costs and really helping them to make an informed business decision as they move forward. Okay, so thus far, we've talked about the potential pitfalls around staffing capabilities, making sure that you're looking at maintenance and updates. The third pitfall that we talked about was the time to procure and implement your solution. Kevin just walked through, you know, really helping you to get your arms around and understand and recognizing your real costs. The last and final, but last but not least, potential pitfall that you're going to want to consider and make sure that you work to avoid is disaster recovery. And I think we're going to bring back Chris Meyer here, and I think you're going to be surprised with some of the insights that Chris has, because a lot of people make some underlying assumptions about disaster recovery, and you're going to be surprised at what some of the underlying causes of that really are. And I think this is going to shift your thinking in how you consider this potential pitfall as you consider moving to the cloud. So with that, welcome back, Chris. Tell us about disaster recovery.
Thank you, Kevin. Disaster recovery is a very important topic, whether you're talking on-premise or a hosted solution. It's a strategy that needs to be thought through and planned throughout the organization, regardless of your infrastructure location. The question you really need to ask is, have you really and fully addressed your risks for disaster? Disaster recovery, like I said, it's a hot topic, and there's a dime a dozen vendors out there ready to sell you disaster recovery solutions. And odds are the first thing that they're going to bring up is natural disasters. It's kind of the big dark cloud that everybody talks about. A couple of case studies that actually do involve natural disasters. We've seen one customer in northeastern Minnesota about, I want to say 4 years ago, there was some torrential downpours causing some flooding in the area, and it really began to threaten the hospital, and potential of the hospital actually flooding was a real risk. In that scenario, their EHR was in a hosted solution and was not on-premise at the hospital. So regardless of the disaster that they were going to experience there, whether it were evacuation or other, they did have comfort in knowing that all of their patient data and all of their technology was off-premise and in a secure location. Second scenario was another natural disaster, and there was forest fires up near the Boundary Waters area near Canada. That was a very very bad situation, and the hospital was kind of sitting there watching this fire get closer and closer to their environment. They again also had their EHR off-premise in a hosted solution, and therefore all of their patient data was not at risk. They did have some on-premise applications and data. However, they were able to very quickly call their hosting provider and have them created a solution to get that data off-site and preserve it in case the hospital did, God forbid, actually burn. So those are two examples of natural disasters. Again, that's usually the most talked about thing. However, what is really the most common cause of a disaster? 55% of the time, it's going to be a hardware failure. We've seen component failure time and time again. It's actually a lot more common than people might think, and it's one that can be remediated and avoided through architecture and design. The second biggest cause for disaster is human error. This one I think gets overlooked quite often, but I think if you evaluate even some of your own system disruptions, you'll find that simple human error, accidentally unplugging the wrong device, or deploying a patch that ended up blue screening a server, those things happen, unfortunately, can happen often. And the third most common cause is software failure. That's bugs in code, again, can be caused by updates, just general application failures. And the least likely cause of a disaster is a natural disaster. And these typically you can kind of have some foresight in, depending on the area you live in. You know what your risks are for natural disasters. So when you develop a disaster recovery strategy, it's really going to be, it's not a one-size-fits-all. So you're not going to be able to talk to a vendor who's going to be able to provide you with a solution. You really have to be an active participant in developing that solution for your organization. The first thing you really need to do is understand what is mission critical for your facility and what isn't. In looking at your applications, I'm sure there's dozens of applications that are used throughout your facility. Which ones are truly mission critical and which ones are secondary or can you do without for a week, etc. You really want to evaluate those applications and prioritize them from top to bottom. Secondly is power. We've talked about power a few different times. The power needed to run IT equipment is different than power needed for the rest of the facility. It's different in the sense that if you're using shared power, what is the capacity that you have there? If you're seeing power draws, what in your facility is going to get that power? What's going to have the priority over that power? Is it going to be patient care areas or is it going to be your IT equipment? Space. We've talked about real estate within the hospital as well. Do you have the space to dedicate to IT equipment? Keep in mind this is non-revenue generating space. This is space that's just going to hold a bunch of blinky lights. We talked about test environments. Do you have the space to accommodate duplication of equipment? Not only for disaster recovery and failover, but also for testing environments. We've talked about air conditioning as well. This one also gets overlooked. People think, well, we have pretty good air conditioning in this room. This will work. the air conditioning requirements for IT equipment is different than that which is used in what's called occupied spaces or office spaces, patient rooms, etc. Both the humidity controls as well as the temperatures are different and unique for IT equipment. And do you have redundancy in those air conditioning systems? So you need to look at all these different areas of your IT delivery systems and prioritize which ones are at risk and which ones do you address first. Consider hosting options and which risk a hosting option would mitigate. So again, some insights. Have you really and fully addressed this issue? When we talk about some of the risks that you face, whether it's power, air conditioning, real estate, etc., keep in mind that the reason that the hospital was built was for patient care. The reason a data center is built is to house critical IT infrastructure. And it's truly a purpose-built facility. I don't know if any of you have had the opportunity to tour a data center, but it was truly purpose-built to house IT equipment and provide the most availability possible. Decide what's truly mission critical for your organization. Some people would be surprised when they actually sit down and take the time to look at all of the applications and components within their facility, what is really deemed to be important and mission critical. It's something that I think each department's probably going to have their own ideas on, and so it's going to be unique to each organization, and it's something that has to be really collaborated on and determine what do you really need to run that hospital and provide the best patient care. Unless you have Microsoft or Google money, you really can't address every risk, but you should, through the prioritization, what you want to do is really focus on the top priorities and try to address as many risks as you can afford to. And in a lot of cases, you'll find that moving to a cloud-based solution is going to provide the most risk mitigation for the least amount of money.
Nicely done, Chris. Okay, good insights on disaster recovery. A few surprises in there, I think, for everybody, all of our viewers, particularly the one we all assume that it's a natural disaster when most of the time it's a hardware problem. And so I thought that was interesting and an eye-opener for me. Okay, so if we go back and kind of look at where we've been and where we are right now, we've talked about these 5 potential pitfalls to avoid as you consider moving to the cloud. Jody talked to us about staffing capabilities. Chris Meyer addressed in great detail maintenance and updates. Chris Olberg talked to us and gave us some very strong insights on time to procure and implement. Kevin Vorboom brought in the financial perspective to this discussion and really helped us get our arms around understanding and recognizing your real costs. And as you've just heard from Chris Myers, he's talked about and addressed the pitfall of disaster recovery as you consider moving from the cloud. So as you make this decision and you think this through for your organization, keep in mind that there is not a single right answer for any organization. You have to do what best fits your situation, your environment, and your strategies as an organization. Here's some final insights for you to consider as you move forward today. First of all is ask yourself the question, are you in the healthcare business or are you in the IT business? As you can see and as you know, IT has gotten very complex, it's gotten very expensive. There's some trends with IT commoditization. It is not an appreciating type of asset, it is a depreciating or commoditized item out in the marketplace, and so that may create some opportunities for you to consider. Secondly, think about, do you and your staff really have the expertise you need to effectively deal with these 5 areas? Ask yourself this question and be honest. Are you well equipped to address these 5 areas and these 5 potential pitfalls in great detail and think them through to make sure you've got answers for each? And finally, make sure that you address these 5 issues before your next hardware upgrade and refresh. And as we've mentioned, it is not just the cost component. It can be infrastructure, it can be technology, it can be on-premise, it can be off-premise. There's a lot of informed decisions that need to be made as you weigh this. And as Chris Oberg pointed out, start this as early as you can. Get your arms around and get answers to these questions before you get so deep into this that you're forced to make bad decisions for your organization. So with that, and in conclusion, I have something very important to share with you. In the time that we've had together today, we've really worked hard to provide you with some advanced strategies and some best practices and some practical tools and some case studies for you to evaluate and plan and make the move to the cloud if it makes sense for your organization. Anytime you attend a webinar like this, you sit in on a session like this, you can do one of two things. You can either do nothing with this, or you can take some type of action. If the content of today's webinar resonated with you and you'd like to go deeper on the topic and explore this deeper for your organization, we'd love to support you in that process and help bring further clarity to that decision process. To discuss how your organization can benefit from moving to the cloud, you could reach me directly at kmcardle@csusolutions.com. My direct dial number is up there as well, 612-865-7503. We'd love to talk with you. We'd love to bring further clarity and walk through these 5 potential pitfalls for your specific needs and application. And so please do. We'd love to support you in this process. And I do want you to know that all of us here today want to thank you and acknowledge you for attending our webinar today and for your interest in our programs. We hope that you've liked what you've heard and found it of tremendous value for you and your organization. Thank you again for joining us for this session, and until next time, this is Kevin McArdle and the entire CSU Solutions team just wishing you all the best.